Welcome everybody, I'm Dr. Geoff Abrams of Abrams Chiropractic here in Greenville, South Carolina, and I'm going to illustrate today how you do an adjustment. So before I do that, I want to just explain what I'm actually doing when I'm working on Rachel, our patient, today. Basically, what you have here is the spine, and the way your body works is off of the nervous system. So you've got nerves coming out of each and one of these individual vertebrae, and as you go throughout life, you have tension from your husband, you have tension from work, you have accidents that happen and injuries, and all these things accrue. And over time it puts pressure on these nerves, and then that causes you to have pain. And then these little dots that you can see, I don't know if you can see that, but there's red and blue dots here. That illustrates where muscles and ligaments attach into. So obviously, if your bones go out of place, then the muscles become out of balance. So having said that, what we do as chiropractors, we find out specifically where you're out of alignment. We do that with x-rays and palpation and a number of tests that we use. And we find out specifically where you're out of place, and then we realign your spine. And this is one way of adjusting the spine. Now, some of the noises that you may hear, if you hear it on this videotape, are not bones grinding on bones. That's just gas coming out of the joint space. So right now I'm going to go ahead and illustrate how an adjustment is performed. So Rachel's been so kind as to lay on her stomach, and I use what we call as a flexion distraction table. And what this does, it actually opens up the disc space and stretches some of the deep muscles and ligaments that are in the area out. So as you can see, I'm contacting on her spine, and the table's going up and down. And what that's allowing it to do is to put good nutrients and oxygen in between those discs. So this is what we're doing. We do this for about, I don't know, 30 seconds to about a minute. And then we go right on into the adjustment. Okay? Alright, so what I'm going to do is flatten out this table and have Rachel lay on her side. So Rachel, you can go lay on her side. And then I'm going to go ahead and get in between her legs here like this. And then I'm realigning her pelvis right like that. Okay? Alright, let's get to the next one. Super customer here at Abrams Chiropractic. Alrighty. So, there it was. Okay, you can go sit at the end of the table there for me. Alright. So right now I'm going to go ahead and adjust her thoracic spine or mid-back. So some of you who have a lot of tension between the shoulder blades from either sitting at the desk or just looking down all the time, this will help to relieve that discomfort. So I'm going to go ahead and cross her arms here. Lay on your back, nice and light, and just nice adjustment, okay? And then you can lay on your back. Alrighty, so I'm going to go ahead and adjust her neck, and I know this is the one that most people say, my goodness, what are you doing to her? That's just all Hollywood, folks. This is YouTube. Alright, so go ahead and let's zone in and show her how we're going to do this here. Alright, so all I'm going to do, that's it. It's very simple. And then here's the last one. Alrighty. Come on up, Rachel. How did that feel, Rach?
I felt great. Thanks.
Alright. And I'm paying her to say that. No, I'm just teasing. But at any rate, thank you all for watching. And this is, once again, Dr. Geoff Abrams from Abrams Chiropractic here in Greenville, South Carolina. Elevate your game. Get adjustments.